Joining us now for some insight is Dr. Parviz Kavoussi. Dr. Kavoussi specializes in reproductive urology at the Austin Center for Men's Health. Thank you for being here.
Thank you for having me.
Doctor, can you first tell me about the screening process for men who suspect they may have low testosterone? Maybe they heard one of those ads.
Absolutely. So the way these men should be evaluated is just like everything else in medicine. It should start with a thorough history and physical examination by their physician, where they come in for a visit, they have a conversation, they go over their symptoms, they see what's been going on with them, and they rule out other potential causes. The physical examination is also very important to help us make the diagnosis, and these are probably the most crucial parts of the evaluation.
Yeah, a doctor we spoke with and some of the lawsuits I looked over allege that people died because men who don't truly need testosterone were taking it and then had dangerous, even deadly consequences. How do you make sure that a patient doesn't have other health problems that can't be solved with testosterone?
Well, part of that is again, just being thorough in your evaluation and making sure that we're not just attributing any symptom that we hear to the possibility of low testosterone. Certainly low testosterone is very common, and we are getting more aggressive about treating it, but we want to make sure we're not missing something else. So that's part of our medical training, is understanding how we should be evaluating these men to make sure we're getting the correct diagnosis.
Yeah, and obviously across the country we've seen allegations that in some locations that's not necessarily happening, because there are men who openly admit they're taking it because they want more muscle mass. They may not be of the age of needing testosterone. How do you deal with those younger men who come in who want the hormone but don't really need it because their levels are not that far off from normal?
That takes a very frank conversation, and a lot of this has to do with our ability to clinically decide really who is low and who is not. And you're right, we do see a lot of younger guys. And it's not to say that younger men can't have low testosterone. They absolutely can. In fact, we see it every day. But there are men that have an absolutely normal testosterone level, and when you really talk to them, they don't really have the true symptoms of what we diagnose as hypogonadism or low testosterone. Those guys just get a really frank conversation about the dangers of use when we're not treating to a normal level. That's equivalent actually to an anabolic steroid. It's actually like using a steroid to get a testosterone level that's above a normal range in what we consider a super therapeutic range, and that can be dangerous. So medical use of testosterone is being sorted out to be very safe in the studies that are done in a better methodology manner. But these guys that are wanting it for super therapeutic, very high levels, above a normal range, that can be very dangerous.
Sure. So it sounds like your message to people out there would be to make sure you get a full physical then.
Absolutely. It really needs to be by a trained medical provider that understands how to evaluate and train men with and treat men with low testosterone to get the right treatment.
Okay. Dr. Parviz Kavoussi from Austin Fertility, thank you for your time.
Thank you.